All right, so question one, do I need to enroll at age 65? Let me put this as simply as you'll ever hear it explained. If you're already getting Social Security retirement benefits before age 65, you're going to be automatically enrolled in Medicare. Just keep that in mind. You'll be able to opt out, but you're going to get something in the mail a couple months before your 65th birthday and says, hey, you're getting these retirement benefits already. You're going to be automatically enrolled in Medicare. And if you don't do anything, just know that's going to happen and you're going to be paying for it. In all other cases, you have to do the enrollment manually yourself. Okay, so that's most people in my experience. So you just got to raise your hand and say, hey, I'm ready for it, and then do the enrollment on your own. So with that, here's the real answer to, do I need to enroll at age 65 if I have to do it manually? You can only delay Medicare enrollment if you're currently getting group health insurance from a group or employer with 20 or more employees. All right. So the other caveat to this, that must be from active employment. It can be through your job or your spouse's job, but whoever gets the group insurance that you're on, that employment has to be active employment. So you can't be on leave. You can't be retired. You can't have a retiree plan, anything like that. You can't even be on COBRA. It has to be active employment. So just the regular case of, all right, I'm at work full time, and it's just the regular circumstance. If you are not in that category, then you have to enroll in Medicare at age 65. So that's a bright line rule, which is good because it's black or white, right? So again, if you are getting, let me explain this. If you are getting group insurance from a company with 19 or fewer employees, you need to enroll in Medicare at age 65. If you don't currently have health insurance when you turn 65, you got to get Medicare. If you're on an Obamacare plan at age 65, you got to get Medicare. All right, so I hope that simplifies it for you. If you're one of those people who has to enroll at age 65, here is when you can do it and when you should do it. This is called your initial enrollment period. Okay, it's a 7-month window of time with your 65th birth month in the middle of it. It starts 3 months before your 65th birthday, ends 3 months after your 65th birthday. So you'll see green, yellow, and red here. I like to encourage people, if they know they need to enroll at 65, do it in those green months, 3 months beforehand. It's just a safe way to go so that everything's in place. Any mistakes are corrected by the time your coverage should start. And the earliest your coverage can start is the first day of your birth month. So I'll give you an example here. If you turn 65 on July 17th of whatever year it is, you can enroll and sign up for Medicare as early as April 1st or as late as October 31st. The earliest your Medicare coverage could start is July 1st. So if you enrolled anywhere from April through June, it's going to start July 1st. If you enroll anytime July 1st after, it's going to start later, most likely the first of the next month. So you can probably see why I encourage people just to get it over with, get it out of the way so it can start as early as possible. All right, and you're probably asking the question at the same time as reviewing this, well, what about my current coverage? What if I do have group coverage and I'm going to enroll in Medicare? You can technically keep your group coverage, but in the vast majority of cases, it's a waste of money. You just choose one or the other. And if you have to go to Medicare, just go all in on Medicare. If you were born on the first of the month, this is a small group of people, obviously. It's the same calculation with one exception. You just shift the timeline back a whole month. So you got 4 months before you turn 65 to enroll and 2 months after. And your coverage could start as early as the first of the month before your 65th birth month. I know that's kind of a mouthful, but let me show you the example. This will help it drive home. If you're born on July 1st, your first possible Medicare start date is June 1st. Okay, and you can enroll and sign up for it. Hey, I'm ready for it as early as March 1st.